Hardly do children transmit tuberculosis when they get infected. So most times, once a child is diagnosed with tuberculosis, we want to go and screen the adults around. Where is the source? There are two types of TB, pulmonary tuberculosis and extrapulmonary tuberculosis. So the one in the lungs and then the one outside the lungs, coughing chronically. You know, when we were students then, once someone comes in with cough, or a child maybe in pediatrics, and you ask, the person is coughing, and you now ask that, is there anybody having chronic cough in your environment or family? And they say yes. We'll be very happy. We'll put TB as one of our diagnoses, right? Because we'll use it to defend. You don't know whether the cough is from lisinopril side effect of medication. As far as that person is concerned, we'll say it's TB. So the consultant will ask you, so you say this child has TB, you are thinking of TB. Yes, sir. So why? He's coughing, chronic cough, okay, what else? He's losing weight. And children, most times when they are sick, they will lose weight because they are not eating. But you will bank on it, the child is losing weight.
Ability Inside Disability podcast is aimed at having conversations on learning, intellectual, and developmental disabilities. These conversations are geared towards understanding these conditions like autism, dyslexia, Down syndrome, and support for persons with these conditions and their families. On this podcast, we do have guests that range from teachers, psychiatrists, neurologists, parents, and even persons with these conditions themselves. We would very much appreciate that you share these videos so your loved ones and others can benefit from the content in these conversations. We appreciate that you like them, and we'll also suggest that you subscribe so you can always receive notification whenever other videos on these conversations come. Have a medical doctor in the house today to help us understand what this condition, what this medical illness, maybe that's the word to use, is, and how it could result to intellectual learning and even sometimes developmental disabilities, depending on how it is happening in the body. So, Dr. Kinto, thank you so much for joining us today.
You're welcome.
And the topic of today is tuberculosis. So what is tuberculosis?
Okay, thank you so much for having me here. Tuberculosis is an infectious disease, meaning it's transmitted by microorganisms. So the specific microorganism was isolated in 1882 by Robert Koch, and it's called Mycoplasma tuberculosis.
So how does it infect its host?
Okay, so from inception, tuberculosis was in the 19th century. There was a breakout, and it was associated with poverty, overcrowding, poor hygiene, and all those before it was discovered by research and then isolated that these are the organisms causing tuberculosis. So it's a disease that then was like a death sentence. It was nicknamed consumption. So it consumes the person it infects. You see, they become wasted physically. They lose weight significantly. So they call it consumption or white death, because by then anyone diagnosed with tuberculosis was sure to die. So they even made a place they call sanatorium, where they isolate tuberculosis patients to give them some form of support, but most of them die off there. Yeah, so it's transmitted by airborne droplets. Okay. So from coughing, sneezing, talking, you could transmit the bacteria to an individual.
Okay, so how can this result to developmental, intellectual, or learning disabilities?
Okay, so most times we find that in children, children are mostly under 10, and then most especially under 5s, the preschool, toddlers, infants, even newborns. So now it all depends on the stage where this transmission happened or the infection happened. So there is what we call congenital tuberculosis, where a child is given birth to with tuberculosis. It's a very rare condition, but a mother with tuberculosis, a pregnant woman with tuberculosis can transmit to her child through her placenta, or through the placenta rather. And then, or during delivery, the process, normal vaginal delivery, so coming out through the birth canal, the secretions, the child can aspirate and then can get infected. And it's a very, it's highly, it has a high mortality rate, because once a child is infected, it doesn't come with the classic symptoms like in adults. They just come with failure to thrive, no coughing actually, failure to thrive, fever, lack of breastfeeding and all, and then the child is wasting. So most times you need a clinician who has high index of suspicion and good clinical acumen to even reason towards that side before a diagnosis will be made. Because tuberculosis is a re-emerging infection. There was a time it was eradicated, public health, they said. But with the emergence of HIV, it came back. So we have that. That's why today, any time we make diagnosis of tuberculosis, we need to screen for HIV. They go hand in hand. Then sometimes, because of multi-resistant drug TB that do not respond to the conventional medication, you see that the transmission increases. So we talk about congenital TB in newborns. Then there are other forms of TB where you see a child contacting it from maybe a relative, the parents, neighbors, or any adult around, adolescents, youths, and adults. Hardly do children transmit tuberculosis when they get infected. So most times, once a child is diagnosed with tuberculosis, we want to go and screen the adults around. Where is the source? You understand? All right, so you see that from constant contact with is the source. From talking, sneezing, coughing, they could release these droplets in active TB or open TB and then transmit to these children. The children get infected until the incubation period passes, and then they start manifesting the symptoms. Now, there's something unique as well in children. I talked about the rarity in transmission for children, because one of the ways we said TB is transmitted is from coughing out droplets. Now, children don't have that musculature to gather the momentum to cough out these droplets from their lungs out. You understand? That's one, which is the major driver of transmission. That's one. Secondly, their lung capacity is small, so the bacteremia is not as much as it could be harbored in adults. So they can't pour it out as much. Then thirdly, in adults, tuberculosis can easily be walled off and focused to a particular place. But in children, their immunity is low, so the bacteria can easily overwhelm them and then spread to the different parts of the body. And that's the problem, and that's the problem in children. So most times you see tuberculosis in adults confined to the lungs. So we call it PTB, pulmonary tuberculosis. So there are two types of TB, pulmonary tuberculosis and extrapulmonary tuberculosis. So the one in the lungs and then the one outside the lungs. So outside the lungs, it could be in the brain and the meninges, it could be in the kidney, it could be in the intestine, could be in the lungs, the bones, the vertebral column and all. So that's why you find a case of disseminated TB or the extrapulmonary TB more in children than in adults. Now again, another unique thing with children is that they don't have those classic symptoms we see in adults.
And what are the classic symptoms now?
Adult, you see anyone that comes to you, there's this thing we have that an adult coming to you with a cough of more than 1 month, a chronic cough of more than 1 month, you have to screen for TB.
Should there be blood stain or doesn't matter?
No, it doesn't. Just the cough first. Just the cough. As far as is this thing. So, but there are other associated symptoms, right? So, just the cough. When they come coughing for more than a month, and then there's weight loss.
Okay.
That's another marker. Then they tell you that we have drenching night sweat. Every night I sweat a lot. That's another big positive there. They tell you they have low-grade fever. So usually tuberculosis don't come with the high-grade fever. This thing, it comes just low-grade. They just feel that melee low-grade fever. But you see the chronic cough, the weight loss, the drenching night sweat, and maybe the fever. When you see this, you can close your eye and say tuberculosis, except until proven otherwise. So, but that's not the case in children. Most times in children, you see like difficulty to thrive. They are not thriving. They are not growing as they should grow.
Stump growth?
Yes, so they because it's a highly stressful event. So most of those energy they are from the diet and everything they are taking in, it's channeling to fight and to help them overcome the infection instead of building up their organs and then giving them the energy to grow. And also we talked about the developmental delay, the intellectual impairment and all that. So I will tell you how it happens, right? So it's multifactorial.
Okay.
Now a child gets infected with TB, and then after that infection, 2 to 6 months, it could disseminate, like spread to other parts of the body through what we call the hematolymphagenous pathway, which means through the blood vessels and the lymph drainage. Yes, the lymph vessels you get. So now it goes in there, let's say to the brain, because once it goes into the lymph vessels, most especially, it travels down to where we call the thoracic duct. That's where the lymph fluid, that's the lymph, empties into the blood circulation. So it enters and then goes to the heart. The heart pumps and spreads to different parts of the body, including the brain. So when it gets to the brain, it could infect the brain has a covering we call the meninges, right? The pia, arachnoid, and dura mater covering the brain. That's one of the places that gets infected. Now the
covering of the brain.
Yes. So when it gets infected, it now inflames. That's it gets swollen and then painful and all. You understand? And then now you discover that the cranium, that's the fontanelles you have, these spaces in newborns, is to allow for the brain inside the skull to expand. Then when it gets to it starts closing. Do you understand? Now, when the child's fontanelles are obliterated, they are all closed, from that point in time, the brain stops increasing in size because there's no space within the cranium, within the box of the skull, to allow for that expansion. So there are only 3 things within the box of the skull. So the brain matter, blood, and then cerebrospinal fluid. So those 3 things are in a constant dynamic equilibrium. What it means is that one doesn't get more than the other. It has to be maintained within that. So anytime one becomes much, others have to reduce to accommodate that. So for instance, there is a bleeding in the brain. So blood has increased. The brain matter has to get compressed. Cerebrospinal fluid has to also reduce for that distance to be accommodated. Then you see features of intracranial hypertension, so that the pressure in the brain is very high. You get so, and one of those first symptoms you see, projectile vomiting. The person pours out, vomits very far. You know that something is going on. Now that aside, so we're talking about how this impairment happens. So once it gets there and infects the meninges, the covering of the brain, the pressure within the brain begins to build up. And if for children whose fontanelles are still patent, the head will start increasing in size because fluid is accumulating, everything is accumulating. You start seeing the head getting big. We call it hydrocephalus.
Oh.
Right?
So
yes.
That's one of the reasons
yes.
for hydrocephalus?
Yes. So, but not only tuberculosis will cause that. Other bacterial infection from meningitis in patients or children with their fontanelles still patent.
Still patent.
They have hydrocephalus from that. That's one of the causes, the infective causes. There are other causes. So it could be from other bacteria, like from meningitis and all not. Even some fungal infections could cause that. So, you know, the presence of that infection alone, be it at the meninges, begins to affect the brain. And there could also be the infection within the brain itself.
Around the brain
and within the brain, yes. It depends on how overwhelming and severe it is. So it begins to distort the processes going there. The oxygen coming, they are also fighting for it. The brain cells are struggling to get the toxins, because anytime infection happens, the body reacts to try to control it. Even before you visit your doctor for medications and all, the body sets in, calls soldiers from the barrack, hey, there's something going on here, can you come and help? So all the soldiers, they go, and then everyone now see, okay, is this an armor criminal with guns, or just petty thief, or they want to know what kind of invasion it is, because there are specific types of soldiers in the body that deals with specific types of, yes. So they come and then they screen. Okay, so it's this type. They set in, the body start producing more of that soldier that will deal with this particular person. And there's a release of chemicals, a lot, that helps to mediate the process. So chemokines, cytokines, interleukins, all those things help to mediate things like fever. Okay, now let the body, it regulates the thermostat in the brain so that the body will generate heat. So you start shivering to build up heat, right? The hair stands up so that air, this thing will, there will be an air plug to reduce the escape of heat from the body, right? Metabolic rate increases, respiration, the breathing increases, so many things increase, and the body becomes very hot so that it can kill those organisms, right? So those are part of the same. But unfortunately, high temperatures like that, they are not good for proteins. And we said the body structures are protein. It's just like egg. Once you subject it to heat and it gets boiled, you can't reverse it. It's irreversible. So you can destroy some of the proteins like enzymes and certain structures in the body. So that's why I want to come in. And for children under 5, once they have high grade fever, they can easily seize.
Into seizure.
So seizure. So seizure could be one of the problems they get that would affect the brain, because that period of seizing, oxygen does not get to the brain. The brain stops functioning at that time because there is high this thing of electricity. So it's yes. So there is like discharge of electricity, high discharge of the voltage is high. So you see them, they are getting stiff and then seizing. Now, so we said that the invasion of this bacteria can lead to physical destruction of the brain, and then the other things, the other things happening by the cells coming to fight them, the chemicals, the everything can also destroy the brain.
Really?
You understand? Yes. So they can have effects on the brain. That's one. So another thing is we talked earlier about that the growth can be impaired because during that infection, and tuberculosis is a chronic infection. It can stay for very long and continue to make its destruction until probably the person goes to the other side of life if nothing is done. Hardly do people recover from tuberculosis. I say hardly, it doesn't mean there were no cases, but hardly, because that's the natural life, history. It doesn't just go away like that. Instead, it keeps on destroying and doing havoc to the individual.
Can children survive this?
So children surviving, most times, the one I've seen and experienced is through intervention. You know, okay, you want to say something? Okay, and then this intervention could also lead to problems with even the brain development because of the medications. The medications are very strong. Imagine a disease that needs at least 4 drugs, 4 antibiotics at the same time. We call the antibiotics, there is rifampicin, isoniazid, pyrazinamide, and ethambutol. It has to be these 4. So anytime you see someone taking TB drugs, that first line drug, there are 4 antibiotics you combine. So it's a very strong therapy. So you do it the intensive phase about first 2 months, right? They keep taking that 4 drugs. But now to help with compliance, they combine. So the combination therapy, it becomes like a tablet with all the 4 drugs. And then after the first 2 months, you now make it only 2, rifampicin and isoniazid for the next 4 months. So the first intensive phase and then the second phase. So it's for like 6 months. They will be on that drug for 6 months. So imagine the havoc the drug will cause. All those drugs have their side effects. For instance, isoniazid, one of the commonest side effects is what we call peripheral neuropathy. So the individuals taking these medications will tell you that they feel numbness on their legs or their hands. They have pins and needle sensation. They have unusual pain, very severe pain, or some bizarre kind of things on the feet and then the hands. So what is happening? The nerves are getting affected, and it also affects the brain. Why? Because isoniazid is a structural analog of vitamin B6, meaning that chemically they look alike. So when blood is circulating and gets to the kidney excretes vitamin B6 and leaves isoniazid. So before you know, you get depleted of vitamin B6 that helps with the integrity of the nerves, and the nerves begin to malfunction. So that's why it is not complete when you start a patient on anti-COTH, which is what we call the anti-TB therapy, without an exogenous vitamin B6, that's pyridoxine.
It has to be there.
It has to be there because you know that, yes, they will, yes, and yes, so it will flush it out, affects the integrity of the nerves and even the brain, because vitamin B6 helps with neural this thing, build up the cell wall and all nuts. So you see that there are lots of things in TB that could affect the development. So their development, the thriving, the mental and cognitive power or function, and then it affects general well-being. It affects their self-esteem. So imagine a child who was diagnosed of TB and then gets isolated from school and every other person. And you know, they are highly social children. They want to run, to go out to play, to do it, but they are kept in a place. Because once you start the TB therapy, the first 2 to 3 weeks, it's still an open TB, which means you can transmit it, right? But after that 2-3 weeks, the person can interact with every other person whilst they are still taking medication. It becomes a closed TB. You cannot transmit it anymore. You understand? So in that first phase, they will keep them away from school, from whatsoever. So it starts affecting them, and then there's stigma attached to it. Imagine someone you know with tuberculosis, right? So people start avoiding, even the friends, maybe the parents to their friends will be saying avoid once they get, or avoid and all that. So even if they got treated and all that, there's still that form of stigma, and children can notice it. Once you come to play, they will leave you. So it affects them mentally, like their development. And one thing I need to say is that research has shown that at least 50% of children that had TB will have some form of developmental and mental impairment.
Really?
As a residual consequence of it.
That is standard?
Yes, research. Standard, yes. At least 50%. That's how high it is. So some of them will even become deaf from the TB. Some of them will now, that's where they will develop seizure disorder from having
the brain
disseminated TB. Yes. Some of them will have issues with cognitive function. Simple calculation, they can't do it. Some of those neurons and this thing have been interrupted. Self-esteem goes low. Memory becomes a problem because memory has 2 parts, the short-term and the long-term memory. So now the short-term, it gets processed particular period of time, then it gets consolidated by the hippocampi, the 2 hippocampus, to the long-term memory. Some of those things between can be affected, and you see that the child can no longer hold memory for long. So once that short-term memory cannot be processed, consolidated to the long-term, it becomes an issue, and he starts performing poorly in school and even in life generally. So there's also I've talked about the medication that could affect isoniazid most especially. Ethambutol can affect sight. We call it bulbar, this thing, retrobulbar palsy. It could affect sight, could affect color vision as well.
Oh,
Yeah, it could affect color vision. Yes. So some of them are toxic to the kidneys and then to the liver. Right?
But
so the liver and kidney, some of the drugs.
The liver is not functioning, that's fine.
Yeah, so that's why before you place them on the medication, you need to check the function of all those. And then as they're on the medication, there's a particular time you need to call them for review and check the function, if those things are getting destroyed or not. And for children, as I said, the liver, when the liver start getting damaged, they can start having bad metabolism of bilirubin, that thing that causes jaundice, right? And bilirubin can get stored a lot in the body and even affect the brain, right? The same thing, metabolism of other essential things that could help in building the brain matter itself and help in the functioning of the neurons, the nerves and all that. This tuberculosis can come to disrupt everything. It's a very overwhelming disease when it comes to children. And a lot of them, if no intervention, would even they will pass on. Yeah.
So what should the adult female in this case now?
Okay.
What measures can be put in place before conception, during conception? Is there anything that can be done for an already infected adult female?
Okay, for an infected adult female. All right, so the female is infected now.
Yeah.
Now, you know, there are several levels of prevention, right? So there's the primordial, primary, secondary, tertiary, and then the surveillance, which is the fourth level. Now, the primordial level cannot be really instilled into this woman that is already infected. And that's primarily on the government.
Because the primordial is total prevention.
Yes, so sanitation, reduce overcrowding, educate people, all those things are primordial levels of prevention, preventing any form of disease.
Okay.
So it's on the government, right? And then their personnel and all. Now, the second level is that, okay, there's the risk. The infection has not happened.
Yes.
So now, how can we prevent it?
But there is a
But
risk.
in this woman, you see that she has it already.
Yes.
The hypothetic
hypothetical
scenario.
one has it
So,
already.
which means primary prevention is not her thing.
Yes.
Then secondary prevention, now you have the disease. How can you prevent complication?
Okay.
So this one can help in our context,
Yes.
both for the mother and the child. So now, for the child, as I said, there could be transmission through the placenta, the vein, yes, and then maybe during delivery, if the woman is still having an open form of TB and all that, they could pass on. And even after delivery, if she's coughing and all that, if she has open, she can transmit this infection. So now, treatment has to be, once that diagnosis is made in her, treatment has to be initiated. But as I said, some of the drugs are toxic. So you need, but there are different levels of treatment. The phase 1, then there's phase 2, comprising different types of medications. So depending on the obstetrician, right, and then they will invite infectious disease specialists. They will come review the pregnant woman. Okay, she has TB. Now check the different functions of her organs. They are working fine. Then they will now decide on her, this particular woman that is pregnant, what treatment should we start on this woman, right? Should we go with the first line, or the second line, or even the third line, so that we are also considering the baby and what the fetus, what stage is that? Is it the embryo phase? Is it fetal? Is it first trimester, second trimester, third trimester? Yes, so when the diagnosis was made, what stage is that baby in? And they are sure that this baby is viable and nothing has happened. So that you put all those things into cognizance before you start the treatment. And once you do the treatment, you are preventing the baby from getting it either through the placenta or during delivery.
Does it make sense for a woman who is infected with TB, with all of this overwhelmness, does it make sense for you, for a woman with TB, to get pregnant?
Okay.
That is putting together all of the process, all of the toxins of the medication, because even when you're treating the woman, regardless of the line you're using, there is toxin, and the child is taking in this toxin. So, does it make sense?
All right. So, in such scenario, like a woman who comes in and then a diagnosis of TB is made, any reasonable doctor will want to advise against getting pregnant. Because it's a very, from the word go. Yes, from the word go. If she's on family planning, you want to strengthen it. Let her be very
healthy first.
Yes, so she should be very adherent with her family planning, whatsoever method she's using that is effective, right? And you want to reinforce or want to educate her more on how to use it to get the adequate effect or the optimal effect. And then you also want to know what exact family planning this thing she is on, because some of those drugs, as I said, some of them are enzyme inducers, some are enzyme inhibitors. What it means is that some of them will increase the function of that family planning medication she's taking. Some of them will reduce the function and then open her up to pregnancy. Do you understand? So you
some
need
of
to
the medication she's taking for the TB.
Yes.
Okay.
So because some of them are enzyme inducers, some are enzyme. I don't want to go into the details of those, but what it means is that some of them can increase the effect of the drug.
Of the family planning.
Yes. Some of them can reduce the
make
effect.
her susceptible.
Yes. So it seems as if she's not on any family this thing. She can ovulate and all and then get pregnant.
Exposed to the possibility of becoming
pregnant. And the drugs are not good. Most drugs are not good in that early phase of pregnancy. Because that first 2 months of pregnancy, 2 to 3 months of pregnancy is known as the embryogenesis phase, where every organ is being formed. So any little thing that happens, you will miss out on the formation of an organ or even a limb or something, and a child can come without hand, or even without the brain.
Or half of the brain.
Yes, and most of them cannot thrive with that. So we would advise strongly on that, on getting pregnant while on TB drug or just getting diagnosed and all that. It's a red flag, and we would not want it to fly. So we can just advise, even if you are working to get a child, just treat and then let's be done, so that you can do that. Right?
Same for the men too.
Yeah, for the men. So men, there are no much issues like that because they are not the ones holding the baby and all that.
So what about if the man is affected?
He can be doing his treatment. Once he's close, he has close TB that cannot be transmitted. He can continue his interactions and all.
Really?
And if he's strong enough and all that.
Okay, once the TB is closed, it cannot be transmitted?
Yes. So that was what I said initially. That first 2 to 3 weeks of treatment, yes. So that's the open TB, so it can close. So that term simply means it has now reduced the number of bacteria and the potency, the strength to get transmitted, to fight, to do destruction, the virulence, reduced it in that 2 to 3 weeks, so that even the patient, most of them stop coughing. And it's coughing that brings out the bacteria as aerosols and then transmit, or sneezing or talking. But once you take the treatment for about 2 to 3 weeks, it becomes a closed TB. It becomes very rare to transmit as much as you continue your medications.
Okay. The primary risk that you talked about earlier on, is it the risk stage? We're talking about the primordial and the primary.
Okay, yeah.
What are those? How will I put it now? What will be the pointers? What will allow you know that this person is at risk of TB? Is it present in the environment?
Yes, so that's one of the primary things.
Yeah, so what are those things?
That there is someone coughing chronically.
Okay.
You know, when we were students then, once someone comes in with cough, or a child maybe in pediatrics, and you ask, the person is coughing, and you now ask that, is there anybody having chronic cough in your environment or family, and they say yes, we'll be very happy. We'll put TB as one of our diagnoses because we'll use it to defend. You don't know whether the cough is from lisinopril side effect of medication. As far as that person is concerned, we say it's TB.
To make your job
easier. So the consultant will ask you, so you said this child has TB, you are thinking of TB. Yes, sir. So why? He's coughing, chronic cough, okay, what else? He's losing weight. And children, most times when they are sick, they will lose weight because they are not eating. But you will bank on it, the child is losing weight. Okay, what else? You have chronically coughing adult. They won't fail you. They won't fail you. Yes. They just feel that, okay, this guy is thinking. At least you have, So that's this thing. As far as there's someone having
that
chronic
cough
cough,
is a very strong
chronic cough.
Well, why would somebody get TB? Because like HIV now, you know, it's something that is in the body, it's transmitted. Is it staying in a dirty environment, or what could be the reason why someone becomes infected?
All right. So as I said earlier, TB is associated with poverty, associated with overcrowding.
Dirty?
Yes, so poverty, most times poor environment they are dirty, right?
Okay.
Because of probably educational level, the exposure, their associations and all that, right? So they are that dirt, that's one. Secondly, low level education, most times in poor environment, so that they don't even know what TB is. Talk more of what preventive measures are or what to do. Even when they have symptoms, sometimes they go to the alternative medicine rather than the conventional. So they don't come for diagnosis early, right? They don't eat well, so their immunity could be low from either stress, chronic stress, from either other forms of diseases, from poor diet, so they can't build good immunity. And also it's multifactorial. You understand? So once a place is overcrowded, if anybody picks TB from anywhere, they can easily transmit it. And sometimes some people have latent TB,
What's that?
which we have a lot in Nigeria, in sub-Saharan Africa, in Southeast Asia, in South America, and then so many places that are overcrowded, third world countries, developing countries, or low and middle income countries. Do you get? So what the latent TB means is that this TB is in the body, but it's just sleeping.
Oh,
you understand? Yes. So it's just sleeping until your immunity gets low, so much so that the TB now, the organism now feels that so it activates, and then you form full-fledged TB. So in that regard, or in that context, you don't really need any active person coughing or something, but that this TB has been there. Yes. And some people, they get it from cow milk, unpasteurized, which is another common cause of TB. So we also ask that question: do you drink cow milk? Like all these local, they say yes. We'll go to TB. We like those simple things, right? So they say they consume unpasteurized. We tell the consultant they consume unpasteurized, and they say okay. Yeah, because so that's one of these things, and that's why yogurt is preferable to the unpasteurized. Yes, because you can get TB from these things. And most times that sort of TB is the abdominal TB, because that's where the organism goes first before it disseminates to other parts of this thing. So now, how do we get this latent TB?
Yes.
You know, the first active way to prevent severe forms of TB is the first immunization a child gets. BCG. Okay. Bacillus calmette-guerin. So BCG is a weak form of tuberculosis.
Really?
Right? So you inject the child so that the child will build immunity against it, so that anytime tuberculosis comes, it can fight it. Do you understand? But you don't give every child, because you could give a particular child and he will come down with TB. So you need to assess the nutritional status of this child, assess the immunity of this child, and so many other things before you give BCG, because it is the bacteria, the tuberculosis culture itself, but weakened. We call it attenuated. So once you give it in a child that has low immunity, poor diet or poor nutrition, failure to thrive and all that, the the guy will go and activate because the environment cannot suppress it and the body cannot build immunity against it. So it becomes full-fledged TB and can kill the child or do any of those havoc we talked about. Now, BCG, I should say very quickly that it doesn't prevent tuberculosis, but it prevents severe forms of tuberculosis. Okay. You understand?
So you can still
yes.
Be infected with tuberculosis.
Yes, whilst you have the BCG, but not the severe types. And which are the severe types? Mostly the extrapulmonary TB, like the Port disease, that's TB going to the spine, destroying the spine and deform the child. So the child now gets kyphosis, like all these like hunchback or so, cannot walk well, get all that deformity. It could be miliary TB, the one that goes to the liver, overwhelms it, destroys the intestines and the mesentery. It could be the TB of the bones, go to different bone, cause fracture, all those things. Then the one in the brain, the TB meningitis and all those other this thing. Yes.
Results to significant development.
Yes. So okay. Yes, exactly. So now, there's something I should say as well, because this is a public platform and people should know. If you check anybody without the scar, that scar is not vaccinated, is not immunized.
There's always a scar?
It has to be. So which means a baby can be vaccinated but not immunized. Vaccination is different from immunization.
But BCG is dropped now.
No, it's subcutaneous. Yeah, it's polio that could be dropped because there is the polio, the killed, and then the attenuated one that you can just put drop and up. But BCG is the first injection. So every baby, every Nigerian you check without that scar is not immunized. Cameroonians, I think they have their own on the hand there. They don't do it on the deltoid. Okay. But it has to be just under the skin, just under the skin to form that reaction. Right? So that there will be inflammation and everything. That's where the scar forms because it's like an injury now. So inflammation and everything. So those soldiers that will come, they will see the insult, the criminal, and then they will form the particular soldiers that are a kind of, needed to fight it. Those ones are stored in the body. So anytime a TB organism comes in, they can now wage war against it because they are there standby. So what do I mean that a child can be vaccinated but not immunized? So the vaccination is the process of bringing the drug in the injection, putting it under the skin and then releasing. That's vaccination. Immunization means the body now building soldiers to fight that inoculum, this thing they put, right? The TB they put in, they inject. When the body builds soldiers to fight it, that becomes immunization. That's now you have the soldiers that can confer immunity or protection against this particular organism, which is TB in our context. Now, what can lead to vaccination without immunization? So there are different factors. So it could be the giver factor, the person injecting. Really? 1. It could be the vaccine itself. 2. It could be the site of injection. 3. And then it could be the baby. So it's multifactorial, yes. But the best thing is just that if you see that scar, that's all. Even if it was a blind man, a deaf man, a cripple, or anybody that did that thing, he did it well. That scar has to be there. So once our consultants then they will ask, is this baby vaccinated? Is a catch. Because the vaccination, you can ask the woman, is your baby vaccinated? She will tell you yes. Then they will ask you, is the baby immunized? So if you don't know the difference between vaccination and immunization, you will say yes to something that will hang your neck. So the vaccination, you can ask the mother, did you vaccinate? You say yes. When she may tell you the day of delivery or the second day or something, because that's the first immunization. But what will tell you if this baby is immunized is that scar. So if you just go and check the scar, there's no scar, you tell the consultant the baby is not immunized.
So the baby was vaccinated?
Well, not immunized because the scar is not
Which
there.
means the baby does not have internal protection?
Yes, so the baby is not
So
protected.
they are very open
to
such infection as TB.
You understand? So all Nigerians, you have to have that scar.
So if you don't have the scar now, what happens now? You have to go back to get the vaccination now.
And so it becomes like a misdiagnosis. So you say an adult went for a baby vaccination.
But is that possible?
Yeah. So that's why most times when you are traveling out, they'll tell you to do your tuberculosis test.
Okay.
Yes, even though they know that most of our NPI, that's National Program for Immunization, we have BCG as our first this thing for years. They know that, but they know that it could be missed. Someone can be vaccinated but not immunized. So you can like argue from now till forever that you had the vaccine. They will tell you yes, but you are not immunized because no scar. So that's a sign to show the testament that this person has been vaccinated and then is immunized. Now, you may have someone who wants to deliver the vaccine, but they don't know that it's subcortical, just under the skin, just under the skin to cause irritation and inflammation. Somebody may go subcutaneous, it won't work. Some will go intramuscular, it won't work.
So it must be under the
So
skin.
your technique, yes, the technique of the person giving that vaccine. So once...
It's the one that can be responsible for lack of immunization.
Yes, immunization. So somebody can just catch the baby is shaking and they will just choke it and release. You, the mother, you are happy that we've gotten BCG,
no
but
immunization.
no immunization.
Okay.
Right? So that's one. Secondly, the vaccine itself could be expired. Apart from expiration, the cold chain, the process of transporting this vaccine from wheresoever it was produced till the primary health care or the last place where you got this thing. Sun, tropical region can destroy if there are no proper cold chain, this thing, transportation. So the sun, the heat can destroy the active ingredient. Yeah, so now you give the child, it's something important. It will not work, so the body will not mount immunity against it. So you vaccinated the child, but he's not immunized. Now again, the child that is malnourished, or a child with HIV, or other forms of diseases that causes low immunity in this child, you vaccinate this child, but the child cannot build immunity.
Because the child is malnourished.
So what can even happen is that you've now infected the child, so the TB can now start, yes, and then you take the child to the other side. So those are some of the very important things. I think parents should know the different things they should expect from a vaccine they are going for. Maybe they should just read it. These are days of internet. Just read, okay, where would this vaccine be given? Maybe so that the one they are supposed to give on the tie, you see the guy going to the Delta, you now ask, okay, why? Probably it's a new person that doesn't know this thing, or that BCG the doctor is coming to give, or anybody is coming to give on the tie, you ask question, because it's always on the this thing, and most times on the left. Cameroon, so everybody has its own policy. As I say, Cameroon, I think, is on the surface of this thing here. So that's what this is it custom officers or immigration this thing at the borders.
Yes.
So once they just get the person and they check like this and they know this is a Cameroonian, you can't come and tell us that you are a Nigerian. Because they gave birth to you in Cameroon, you got the BCG. Yeah. So except you have other explanations to make. But once they cite that thing, they know that this is a Cameroonian.
Not a Nigerian.
Yeah, not a Nigerian. And they see you without it, they assume it's here, you are a Nigerian, right? Border to Cameroon and all that. So some of those subtle things, they
are there as markers, as to you've had the proper, you've been vaccinated and immunized.
Both are in
So you now would not come with severe forms of TB.
Of TB.
Yes.
But you can still come down
with TB,
but
yes.
Not
or you just get a latent TB, it's just there but no symptoms. So in the UK, once you go there and you are diagnosed, they will tell you to do complete treatment. Or you have to be coming back in a particular duration of time for assessment so that it doesn't get activated, because you put their citizens at risk. And once you get TB, you are seen in this thing, you can be deported back because it's of public health concern. It can become an epidemic and all that. So I think that's this thing. But most times the mental impairment, developmental disease and all that is more in children under 10 and mostly under 5s.
Mostly under 5s. That is the early stages. And like you said, from research, 50%.
50%, at least.
At least 50%. That's at least now. Not even exact 50, at least. 50%. So it can be more than. Children who are exposed to this will have such complications. Wow. Okay, today has been another intense day. Quite intense, but a lot to learn. That you're vaccinated doesn't mean that you're immunized. That's the new one of the new ones I took from this conversation. So please, look properly at your shoulders and be sure that you have the scar. If you don't have the scar, then start working on getting your proper form of tuberculosis vaccination so that you can be properly immunized, whether you're an adult or your children are still growing. Dr. Kimto has really fleshed out this topic and has helped us understand the link, the very strong links between tuberculosis and learning, intellectual, and developmental disabilities. Tuberculosis is clearly a very overwhelming disease. And I hope that public officials, in particular, come across this video. And that is why we keep saying that you should please share these videos. Share them so that it reach places that you never thought they would reach. Like this one now, if public official comes across this, very detailed explanation, hopefully it will reinforce the need for them to continuously sensitize people about this disease, helping them understand the disaster that it leaves in its wake. So let's subscribe to the channel, let's like, and let's comment. If you have any questions, please leave your questions in the comment sections. We would respond to all of your questions. We want you to send questions to us, which means you've engaged the videos, which means you've learned something, and which also means that you are also one of those foot soldiers that will do your best to help people do better with regards to the knowledge that you have. So thank you so much for joining us on this episode. Stay safe, stay healthy, stay clean. Don't activate your latent tuberculosis, and make sure you're vaccinated and immunized. Bye.